11 signs of colon cancer you must not ignore. Do you know that colon cancer, also known as colorectal cancer, is the third most common type of cancer in the United States? Originating in the large intestine, a crucial component of the digestive system, this cancer begins as small, benign clumps of cells called polyps. The insidious nature of colon cancer lies in its initially silent progression, often showing no symptoms until it's in a more advanced stage. However, the 5-year survival rate for colon cancer detected at an early stage is around 90%, but this figure drops dramatically to 14% for cancer diagnosed at a more advanced stage. Hence, understanding and recognizing the early signs of colon cancer is a crucial step in taking control of our health and well-being. Today, we're diving deep into the 11 subtle symptoms of colon cancer that you should be aware of. 1. Change in bowel habits. Colon cancer may significantly alter bowel movements due to its direct impact on the function and structure of the large intestine, which plays a crucial role in the final stages of digestion, water absorption, and waste elimination. For instance, tumors in the colon, depending on their size and location, may partially or fully obstruct the passage of stool. This obstruction may lead to constipation or a change in the consistency of the stool. Furthermore, colon cancer may also affect the colon's ability to signal when it is full, leading to a feeling of incomplete bowel evacuation even after using the bathroom. This sensation is due to the tumor interfering with the normal nerve and muscle function in the colon. In a Japanese study involving 25,731 men and 37,198 women over 7 years, the connection between bowel movement frequency and colorectal cancer risk was explored. It was found that women with bowel movements every 2 to 3 days had the lowest risk of colorectal and colon cancer. Conversely, those with bowel movements every 6 days or less showed an increased risk for both types of cancer compared to those with daily bowel movements. 2. Rectal bleeding or blood in the stool. Colon cancer leads to blood in the stool, primarily due to the way cancerous growths or tumors interact with the delicate tissues of the colon. As these tumors grow within the colon's lining, they may invade and damage blood vessels. The result is bleeding, which then becomes evident in the stool. The appearance of blood due to colon cancer may vary. In some cases, the blood might be bright red, which usually suggests that the bleeding is occurring in the lower part of the colon or the rectum. In other instances, the blood may be darker, almost black in color, which typically indicates that it has been digested and is coming from higher up in the colon. This darker blood is often mixed in with the stool, giving it a tar-like appearance. In a study of 604 patients, 22 were diagnosed with colorectal cancer, where key factors predicting cancer risk included age and the presence of blood in stool. Patients aged 50 to 69 had 5 times the risk, and those over 70 had more than 8 times the risk compared to those under 50. Blood mixed with stool significantly raised the likelihood of cancer. Do you find this information helpful? Don't forget to hit the subscribe button and ring the bell icon for more health secrets and tips. 3. Persistent abdominal discomfort. As a colon tumor grows, it may cause partial or complete blockage in the large intestine. This blockage may lead to a buildup of gas, stool, and other contents in the intestine, which in turn leads to stretching and pain. In addition to the mechanical obstruction, the tumor may also infiltrate and irritate the lining of the abdomen, causing inflammation and pain. As the tumor progresses, it may penetrate through the colon wall and affect nearby organs and tissues, leading to more widespread pain and discomfort. In a study focusing on abdominal pain and cancer risk, it was found that this risk increases with age, especially in men. For men over 70, the risk of intra-abdominal cancers like colorectal cancer is 3%, significantly higher than expected. The risk is even higher in men aged 60 to 69 with additional symptoms like diarrhea. The study concludes that abdominal pain in older men warrants further investigation due to the heightened cancer risk. 4. Weakness or fatigue. According to studies, fatigue is also a common symptom in patients with colorectal cancer, particularly in those undergoing treatment, where 46% of patients experienced moderate to severe fatigue during treatment, while fatigue persisted in 27% of survivors. One of the key ways colon cancer causes weakness is through chronic blood loss, which leads to iron deficiency anemia. Anemia reduces the oxygen-carrying capacity of the blood, which is crucial for energy production in the body. Consequently, patients often experience a pervasive sense of fatigue and weakness. Apart from that, the metabolic demands of the growing cancer itself also play a role. Cancer cells consume a significant amount of the body's energy resources, leaving a person feeling weak and fatigued. 5. Unexplained change in weight. Primarily, colon cancer may affect appetite. Patients often experience a reduced desire to eat due to discomfort or pain in the abdomen. Changes in bowel habits, or the psychological stress of dealing with a cancer diagnosis. All these factors may contribute further to weight change. Furthermore, systemic inflammation, a common response to cancer, may also lead to muscle wasting and a condition known as cachexia. Cachexia is characterized by the loss of muscle mass and fat, even if the patient is consuming adequate calories. This complex metabolic syndrome contributes significantly to weight loss in cancer patients. A study involving 46,349 men aged 40 to 75 investigated the link between weight change and colon cancer risk. Findings showed that a cumulative mean BMI above 22 points significantly increased colon cancer risk by 30%. Additionally, short-term weight gain of around 5 kilograms in the previous 2 to 4 years was linked to a 14% higher risk. Weight gain since age 21 also influenced risk. Every 5 kilogram increase per decade raised the risk by 33%. 6. Iron deficiency anemia. Colon cancer often leads to iron deficiency anemia through chronic internal bleeding, which may occur as the cancerous tumor in the colon grows and invades blood vessels. Over time, it leads to a gradual depletion of the body's iron stores, resulting in a decrease in the production of hemoglobin. Thus, often people develop anemia while battling colon cancer. Additionally, colon cancer may also impact the body's ability to absorb iron and other nutrients effectively, especially if the tumor is located in parts of the colon responsible for nutrient absorption. The combined effect of reduced absorption and chronic blood loss further exacerbates the risk of developing iron deficiency anemia. As for colorectal cancer patients, anemia is considered the most common extraintestinal symptom, appearing in 30% to 75% of patients. Preoperative anemia is reported in approximately 50% and 20% of patients with colon and rectal cancer, respectively. In the postoperative period, the incidence of anemia increases to 77% and 66% respectively, mainly because of the intraoperative blood loss. 7. Abdominal bloating. A key finding from various studies is that the association of bloating and abdominal distension with rectal and distal colon cancer is really important. Paying close attention to these symptoms may lead to the early detection and diagnosis of these specific cancer types. But why does it happen? Abdominal bloating in the context of colon cancer is often a result of the tumor's impact on the normal function and movement of the intestines. As a tumor grows in the colon, it may partially or completely block the bowel, leading to a buildup of gas, stool, and other intestinal contents. This accumulation may cause the abdomen to distend, resulting in the sensation of bloating. 8. A lump in the abdomen. Colon cancer may lead to the formation of a palpable lump in the abdomen, primarily due to the growth of the tumor itself. As cancer in the colon progresses, it may grow to a size where it becomes tangible during a physical examination. This is more likely when the tumor is located in parts of the colon that are closer to the abdominal wall, such as the ascending or descending colon. Locally advanced colorectal cancers, which represent 5% to 22% of all colorectal cancer cases, are characterized by their invasion into adjacent organs without spreading distantly. The abdominal wall is particularly susceptible to invasion by tumors originating from the intraperitoneal portion of the colon. It's important to note that not all lumps in the abdomen are due to cancer. There are many benign reasons for lumps, such as cysts, non-cancerous tumors, and other conditions. However, any new or unusual lump in the abdomen should be evaluated by a healthcare professional to determine its cause. 9. Shortness of breath. There had been a case report that highlighted the unusual presentation of colorectal cancer in a 71-year-old male patient who was admitted to a medical facility primarily for exertional dyspnea. The patient experienced difficulty breathing after walking just 200 meters on a flat surface, a symptom that had persisted for several weeks. It shows the importance of counting shortness of breath as an indication of colon cancer. When colon cancer causes bleeding, even if it's not visibly obvious, it may result in a gradual decrease in red blood cells and hemoglobin, the protein in red blood cells that carries oxygen throughout the body. This reduction means that less oxygen is available to be delivered to the body's tissues, including the muscles and organs. It leads to an increase in respiratory rate in an attempt to bring more oxygen into the system, leading to the sensation of shortness of breath. In more advanced stages, if colon cancer has metastasized or spread to other parts of the body, such as the lungs or liver, it may further exacerbate breathing difficulties. When the lungs are involved, the cancer may directly interfere with the respiratory system's ability to function properly, either through the growth of tumors in the lung tissue or through the buildup of fluid around the lungs, which may compress the lungs and make breathing more difficult. 10. Jaundice. In a study of 62 patients with metastatic colorectal cancer who developed jaundice, the most common cause was found to be intrahepatic biliary obstruction, particularly in younger patients. The primary way jaundice occurs in this scenario is through the disruption of normal bile processing. Cancerous tumors in the liver may block the bile ducts, the pathways through which bile flows from the liver to the intestines. When these ducts are blocked, bile accumulates in the liver and then spills into the bloodstream, leading to an increase in the levels of bilirubin, a yellow pigment that is a byproduct of the normal breakdown of red blood cells and is usually processed by the liver. As bilirubin levels in the blood rise, it starts to deposit in various tissues, including the skin and the whites of the eyes, giving them a yellow hue, which is characteristic of jaundice. In addition to yellowing of the skin and eyes, jaundice may cause dark urine, light-colored stools, and itching. 11. Frequent indigestion. The primary way indigestion occurs is through the tumor's obstruction of the bowel. This obstruction may slow down or hinder the passage of food, causing a backlog in the digestive system. This interference may manifest as indigestion, a broad term encompassing various gastrointestinal discomforts like heartburn, bloating, and nausea. Additionally, as the tumor progresses, it may affect the natural motility of the gastrointestinal tract. The colon's normal contractions, which help move food through the digestive system, may be disrupted, further contributing to symptoms of indigestion. In a study of 45,828 patients with gastroesophageal reflux disease, researchers found a higher incidence of colorectal cancer in those people. Specifically, gastroesophageal reflux disease was linked to a 76% increased risk of colorectal cancer. Who is at the highest risk of colon cancer? Certain factors may increase an individual's risk of developing colon cancer. It's important to note that people with no known risk factors may also develop the disease. Still, it's better to learn the risk factors to remain on the safe side. 1. Age. The risk of colon cancer increases with age, with a significant majority of cases occurring in people aged 50 and older. However, it may occur at younger ages too, especially if other risk factors are present. 2. Personal or family history. Individuals with a personal history of colorectal cancer or polyps are at increased risk. Also, those with a family history of colon cancer or polyps, particularly in a first-degree relative, parent, sibling, or child, have a higher risk. 3. Inherited genetic syndromes. Certain genetic mutations pass through families, like Lynch syndrome, hereditary non-polyposis colorectal cancer, and familial adenomatous polyposis, FAP, significantly increase the risk of colon cancer. 4. Ethnicity and race. African Americans have a higher risk of developing and dying from colon cancer. Ashkenazi Jews also have a higher risk. 5. Certain medical conditions. Conditions like inflammatory bowel disease, including Crohn's disease and ulcerative colitis, may increase the risk. 6. Lifestyle factors. Diets high in red and processed meats, physical inactivity, obesity, heavy alcohol consumption, and smoking are associated with a higher risk of colon cancer. The 11 signs of colon cancer outlined here are vital indicators to watch for, serving as potential harbingers of a condition that, if caught early, may often be successfully treated. While some symptoms might seem minor or easy to dismiss, their potential significance cannot be overstated. If you experience any of these symptoms, it's crucial to consult with a healthcare provider. Early medical consultation may lead to timely diagnosis and treatment, significantly improving the chances of a positive outcome and potentially saving lives. Remember, when it comes to health, especially concerning colon cancer, being proactive and informed is key. Now that we have discussed the many signs of colon cancer, there are always other signs of health we should look out for. From kidneys to pancreas. Interested in learning more? Watch. Save your kidneys from damage by eating these 13 foods. Or watch 9 foods to save your pancreas from damage. Watch one, or even better, watch both. What are the other signs you know that may indicate colon cancer? Let us know in the comments below.